Now, there is no end in sight for the doctors' strike after talks meant to resolve the impasse between the striking medics and their employers on Wednesday afternoon broke down.
To our top story, it is now more than 2 weeks since medical doctors walked out of their duty stations. Patients in public hospitals remained stranded, with the doctors' union, KMPDU, insisting no amount of intimidation and sacking threats will have them backing down.
Patients across the country are still facing challenges as doctors continue with industrial action.
Kenya Medical Practitioners and Dentists Union Secretary General Dr. Binji Atela was early today seriously injured during demos held by medics here in Nairobi.
Riot police lobbed tear gas canisters at the medics. Several doctors, including their boss, Dr. Mbiji Atela, were injured.
And even worst of all, we have to also condemn that in the whole violence meted on the doctors, 25 young doctors have been injured in the stampede that followed and the subsequent tear gas canisters that were shot at them. We have been picketing for the last 10 years. Every year we have to picket. But this is the first time that we have seen such kind of violence meted against peaceful protesters, peaceful Kenyans, peaceful doctors. All these young people are asking for is to be given a chance to serve Kenyans.
I have given the doctors in Nairobi 12 hours to show up in our hospitals.
Mediation should last only for 90 days because it's not something that we do for fun. Yet at this point, what are the options left? They think that the threat will work. They don't know that the doctors don't care. At this point, we have lost everything. We never dignity we are holding on to. You get that? From being served the indignity of delayed salaries and landlords in your case because of your unpaid rent, to your children being kicked out of school because of no school fees.
Welcome to Laughing Lab Coats. My name is Dr. Mohideen Mohammed. Today I'm joined by the Deputy Secgen at KMPDU, Mr. Dr. Dennis MISKELLAH. Karibu, Doc.
Thank you so much, Mohideen, for having me at the Laughing Lab Coat.
Yes.
Interesting, the title of the show.
Yes. Yeah. Now, there's a big thing going on where there's a strike. Today, I think, is day 15, right?
Day 16.
Day 16.
Yes.
Now, before we come to this day 16 of the strike, we know that there were some issues that were brewing from before that triggered this strike to happen. How would you put that across? Where do you think we should start from?
Yeah. So thank you very much, Mohideen. I think ever since health was devolved, Kenyans have really suffered. Kenyans have paid the price. And the politicians don't seem to care. When health was being devolved, the governors were in a hurry to get the health devolved because they thought that public healthcare system is like the private healthcare system where people are making money and millions are coming in. So they thought that they found some really hit a gravy train. But healthcare as a social function is a loss-making venture. The moment healthcare starts making profit, then the masses will suffer and will end up dying.
Just to be clear, this was back in 20...
Yes, health was devolved in 2010.
Yes.
Yeah. So the governors, the transition authority tried telling the governors that please wait till we put structures in place, wait till we unbundle the cost of healthcare, so that you know that when I give you a level 4, level 5, this is what it takes to hire, to train, to buy drugs. But they said, no. Give it to us, we'll sort it out. Yes.
Uh-huh.
And so President Ruto tried telling them to go slow on it. They refused. So he then said, okay. So he gave it to them. And that's the haphazard way we devolved. And as KMPDU, from day one, we kept on saying that, no, guys, a mistake occurred. And if you have to devolve health, then have a health services commission that can manage the human resources part of it, because health is very complicated. There are almost 42 different cadres in healthcare. And they all have different trainings, different needs, yet they all work together. Like if you hire a doctor, you have to hire a nurse to work with them, a laboratory guy to work with them, a nutritionist. So they all are interdependent. And it needs somebody who knows what they are doing for it to work. So Kenyans have ended up paying the price. Initially, they said that it was just a teething problem. But 14 years later, it can't be a teething problem anymore.
For 14 years, it can't
Yes,
be a
it can't be a
problem.
teething problem. This baby is now a teenager. You know, this baby should be having other challenges, not the teething problems.
Okay.
Of the delayed salaries, acute shortages of workers, no drugs and all that. Kenyans have suffered because even if you have that NHI, if you go to the public hospital, you still have to go out to do X-ray and those
And
tests
lab
outside.
tests
Labs.
as well.
When you come back and you seen by the doctor, you still have to go out again and buy the drugs outside. Yeah. What's in the 3 delays? You know the 3 delays in healthcare. Delay in the patient coming to hospital. Delay in the first delay is the patient making a decision that they need to see a doctor and not some mganga. Then the second delay is with them coming from home to the hospital, because distance. Then finally the third delay, the delay that one that in the hospital, finding the doctor, seeing the doctor, and the right treatment being instituted. So there are 3 delays that have really made Kenyans suffer.
Even if it so happens, I think I wouldn't want to mention where I trained in my internship, but it was sad that we could not do some basic labs for the entire year I was there. The only way we managed to get these people to get a diagnosis of what was going on was either clinically and you work miracles, or you, if the family is somehow financially stable, they would sponsor themselves and go do labs from outside, imaging from outside. That's how it used to work. So it's true that families are affected and generally Kenyans are affected. But if this is a long-standing problem, I think people are looking at the current strike and saying it's post-medical interns, and that is the biggest image being displayed out there. But what would you say there? Is it like a slowly building up of frustrations until imefika mwisho?
Yeah, we know that a building just don't crashes from nowhere. There will be those small cracks that are being ignored. A plane just don't fall from the sky. There's that loose nut somewhere, then lead to something falling off and all that. It's always a chain reaction of small things ignored that finally becomes something bigger. So from 2011, we had a strike around improving our pay, lipa kama tender. Then we moved to one that we did for them to equip the hospital. Then, actually, the first one was the Peremende movement, where we had asked to give a pay rise, and the minister, then Professor Nyang'o, was dismissed as that we had Peremende, because the Peremende movement. Then after that, we had a strike for equipment in the hospital because we were tired of seeing patients dying. We also had a strike for HSC when we were devolved. Then the last one was the Lipakama tender, where we were fighting for the CBA. It was an anchor message. And all this time, when we had a CBA in 2013, the government refused that. It was not a legal document because the PS, who was one of their own, they called him a stranger and threw away our CBA. So in 2016, we gave a strike notice for a CBA. And after 100 days of strike, they finally gave in to a CBA that was signed, and it's their lawyers who took it to court. Then they never implemented it. So we sued them, never implemented it. Then now when we had no option left, we gave a notice to strike in December 2022. The then CS, who's now the current CS, Nakumusha, told us that she's still new in the ministry. We give her time. She'd just been there for like 2 months. So she signed with us a matrix with COG on how they were going to implement the issues addressed. 1 year down the line, nothing was coming.
Nothing was changed.
We did a mediation, that a report came out, nothing. We did math on the amount they owed us, nothing. So that we were left with no other option but to now call for the strike. And the anchor messaging was the interns, because internship is something in the CBA. And it was now taking too long to get them posted. So in the process of us agitating for the interns we posted, then the SG was attacked and almost killed. And then we asked ourselves that, why are we waiting? We wanted to do a strike in June, to be honest with you, after the annual delegates conference to sanction it. So, but now we were like, why should we wait for June? When even the interns, something that is already there, that has occurred over 40 plus years, is now not happening. And when you speak up, they beat us up. It's like, no, let's do it right now, man. There's no right or wrong time to do what is right.
You've mentioned the Ministry of Health, Afya House, and some people in media and even doctors amongst ourselves would call it Mafia House. Do you think the reputation is totally ruined and the ministry is somehow being controlled by someone who is not supposed to?
I think Afya House have just been a punching bag. Because what is Afya House? Afya is just a building. And inside there are technocrats. And most of those technocrats are doctors, men and women of integrity. If it was the leadership, we have changed ministers, PSS, we have changed CSS, we have changed directors. It can't be that the people are the problem. I believe that there is somebody at a higher level who sees medicine and health as a business, as a gravy train that they can then use to enrich themselves. People who see the donor funds as money to be misappropriated. Because look at healthcare is right now 90% devolved. Yet almost 70% of the budget remains in Afya House nationally. For what? Your guess is as good as mine. That money, when it stays there, is there to be stolen, to be misappropriated.
I was looking at a certain TikTok by one of the former CSs in Treasury. He was saying that you can't really steal money from the exchequer unless you come up with a debt concept. And do you think is that such a system has been used in Mafia House?
Trust me, I would not pretend that I'm an economist. But I know that the way money is stolen from Afya House and most of these places just through skewed tendering processes, where you give somebody tenders to supply HIV test kits at an inflated price, or somebody to supply mosquito nets at an inflated price. You get that? Or somebody supplying air, like happened during the COVID time. Nothing has been delivered, but they have processed every documentation that something was delivered, and they go get the money. That's how it's done. That's why we need a strike about Lipa Kama tender. It was about pay as though you pay for tenders. Because those tenders, whether they're real or not, as long as you avail the documentation, they pay on time.
Work is done, yeah.
Why can they also pay healthcare workers as prompt as they pay
the tenders?
Yes.
That's really amazing. Now, we come back from the Ministry of Health. We've seen the devolution where previously healthcare was under the national government. Now it's been brought to the counties. We pointed out that the counties were crying for it. They were crying for the job of doctors, where they'll be able to control these doctors. They are now seeing it as a heavy load on them. And with the current ongoing strike, kuna threats from several other governors saying, if you do not go back to work in the next few days, you are fired. What do you think of that? Do you think it's a tactic, divide and rule, sort of?
The governors and the county governments are incompetent. You know, if the only tool you have in your toolbox is a hammer, everything to you will look like a nail. Even if you have a screwdriver, you still want to hammer it. You get that? So because of the incompetence and the desert of ideas in the counties, they think that the threat will work. They don't know that the doctors don't care. At this point, we have lost everything. We never have a dignity we are holding on to. You get that? From being served the indignity of delayed salaries and landlords in your case because of your unpaid rent, to your children being kicked out of school because of no school fees, to your family not being able to get access to healthcare that yourself you're offering, to you having those cold rooms with those old chairs and bed bugs. We have been indignified in so many ways that even not for anything else, this strike must get us that dignity back. And so the governors, it's high time they realize that we really don't care. We know what they do. When a strike comes, they go to court. When the court fails, they issue threats and intimidation. Then they stop union dues. Then they stop salaries. Then they sack you. Then finally, they come to the table and talk. So after they're done all their shenanigans, they have to come to the table and talk. Because the Kenyan doctor is saying 7 years waiting for them to implement what they signed. You cannot. Somebody cannot owe you money, hakuna deni yako, then when you go to ask for your money, they want to dictate for you how you should ask for that money. And they are shamelessly quarreling you that umeuliza hii deni vibaya. What do they expect? They owe us a CBA that they signed, they owe us money in it, they owe us promises unfulfilled for 7 years. What else did they want us to do? We have sued them in court, they have refused to obey the court orders twice. We gave them strike notices, they refused to implement them for over 1 year. We have a matrix that they signed, they refused to implement it. What else do they want us to do? Today you call off that strike, they will never come to any table to sit. I can tell you. The mediation we did last year when we began was a full house. With every passing meeting, the numbers kept on shrinking until we were just left with the mediator, Davji and I. So trust me that we've learned. Only a fool repeats the same mistake.
Twice.
Fool me once, shame on you. Fool me twice, shame on me.
Now, there's a concept I came across online where they're saying, in order to be able to tame these doctors, we should allow the formation of other unions. I saw this on Twitter. I can't remember who exactly said. We should allow the formation of other unions within the county levels in order to be able to control. What's your take on that?
First of all, why are we taming the doctors? Are we wild? why do we have to tame the doctors? Trust me, that doctors are not stupid. Even if you add 10 unions, they will never join them. Unions are voluntary. You get that? It has happened in the university where the universities chose to give the medics in the universities, give their money to UASU, the Union for University Staff. But they just said that, no. Also deduct and give the money to KMPDU. We don't mind you double deducting. But for us, we want to belong to KMPDU. So yes, they can have the unions. It's well and good. But doctors will still come to KMPDU because they know that KMPDU is the only umbrella that can shield them from the stormy days currently and to come. KMPDU is the only union right now in this country that can stand up and speak for what is right. KMPDU is the only safe place where doctors can get protection. And they know that. That's why they don't allow anybody to try to cheat them out of that. And as a union, we keep on saying that if at any given point doctors will feel like KMPDU are not serve them, let them not leave the union. Let them kick out the people who are not serving them. Because at the end of the day, union ni yetu sisi wote. KMPDU is ours forever.
Oh, that's really well put. Now, and we saw the president is the one who is running this universal healthcare. What confuses me, and maybe you can answer this, what confuses me is you as the president who you want to take over this UHC bit of it, and yet you have these other sub cadres within the government, now the Council of Governors, trying to also pull. See, that's a bit of confusion to the doctor, to the Kenyan public. How do we sort that?
That's a brilliant question because just about dishonesty. Kenya, we are a country of dishonest men and women. Yet doctors are not dishonest people. And that's why doctors are getting frustrated. Because everybody else have accepted dishonesty as a way of life. But Kenya doctors are saying, no, we have to be honest. You cannot tell me that when it comes to UHC, it's a presidential agenda. And UHC has the 4 pillars. It has the part of the drugs. You are reforming KEMSA. You are appointing people in KEMSA. When it comes to building hospitals, you are building hospitals through VAMED and other private entities. You are opening them as a president and all that. When it comes to financing bit of it, you are putting the law, SHIF, the Social Health Authority Act and all that, you are putting them nationally. But when it comes to the human resource for healthcare, you say, no, health is devolved. When they're buying the equipment, the managed equipment scheme, the tenders, big business, they're doing it centrally in MOH. When they're buying the kits for the CHPs, the community health promoters, they're doing it centrally. When they're hiring CHPs who are just their political cronies, they're doing it centrally to campaign for them. But when it comes to the biggest, most important component in all this, because that drug, that machine won't work without a worker.
Has to be given by someone.
Now they're saying, no, go to the counties. That's being dishonest. If the president is keen on running UHC as his agenda, he must be ready to support all the pillars centrally. He cannot choose the lucrative ones to run centrally and the difficult ones to leave to governors. It won't work, it won't pick, it won't fly.
Wow, that's a proper call out. And this 19 components during this strike, where the union raised 19 issues which have always been ignored. And speaking to you earlier, we noted that there was an agreement where these things will be worked on a certain timeline. Can you brush through and tell us which ones would be given a higher priority, which ones would be delayed, and for what reasons?
So when we gave our 19 issues, we were clear that we sat and looked at the landscape of healthcare in this country, and we flagged up everything that is wrong with it. We did not expect that all the 19 issues will be fixed at once, but we sure did expect that there are certain things that will be sorted out immediately. And in the first whole of nation meeting chaired by the head of public service as ordered by the courts, a subcommittee was formed made of 13 people, 4 from the union and 9 from government side, to be able to pull out the issues and arrange them in order of priority for immediate issues that will be solved before the strike is called off, for the short-term issues that will be sorted within this financial year, and the long-term issues that will be sorted out in the next financial year. And things are moving quite well because as a union, there are certain things that must be sorted out right now. For example, the issue around internship posting. That's something that must be done now. And they must be posted in the right terms. The issue around school fees for postgraduate students who are studying, who are working in KNH and MTRH, yet when the exams time come, they are locked out of exams because Ministry of Health has not paid their fees. They are government sponsored. The other issue is about medical cover. There are almost 10 counties that don't have a medical cover. People cannot work without a medical cover. You cannot offer services that you can't offer.
That you can't get
Yes,
in return.
you can't get. So they must give that medical cover immediately. The issue around our debt that has been now 7 years old, they have to pay part of it immediately. And that part can be factored in the next budget. They owe us 3.5 billion. Then there are the issue around that can be done within the financial period, like the medical cover now for everybody else now that we have moved away from NHIF to SHIF. Yeah, the new plan that they'll enhance the social health insurance for workers. That's there, and they say they're going to do it in the long term. The issue around hiring more workers. The issue around stopping this contract employment where you work in a facility and they pay you a third of what your colleague earns under your contract. Those are things that they had to, we told them that they have to do within the financial year and correct that injustice. Yeah. There are also issues around the pending CBAs where KNH and MTRH have signed CBAs with us, with the union, and they only need SRC to give concurrence that go ahead, we're okay with it, register it. That's something that we wanted them to sort out. So we are fully aware that there are also the long-term issues like around HSC, long-term issues around who is your employer. Do we have to continue being harassed by the counties, or we can find a centralized way of managing HR? So we had all that range of issues that we had agreed on. But as a KMPDU, we are still stuck that the bare minimums of this strike must be there. Again, I repeat, interns must be posted and the right job group. Medical cover must be given. School fees must be paid. Contract employment must be stopped. They're paying people a third of their salary. That's inhuman. Yeah? The issue of the two stalled CBAs must be sorted out. Get that? So that's the key thing that we are still holding on to. We had agreed in principle on most of these things by government. The only challenge came in when the governors came. And as usual, governors are the biggest stumbling block for the success of healthcare in this country. And as usual, when they came to the meeting, they disrupted the meeting. Too sad that the head of public service was not there.
I'd want to take your head away from something that is related to this, but a little bit different, yeah? Online, I got a text from a certain lady. I wouldn't disclose her name. They are quite remote, mashinani. So this was, her father is diabetic. And he has been on metformin for quite some time, but they have those strips. So every time after like using metformin for 6 years, imefika point now sugar control is an issue. So the sugar's in a spike. And then where they stay, accessibility to a physician is every Tuesday for a certain number of weeks, and then physician's contract nikawa imeishi hapo. So my question is, what would you tell this Kenyan who was told today baba yako hataonekana because there is a strike going on, and he should just continue taking his metformin despite us knowing that it hasn't worked? What would you tell such Kenyans who are going through that?
It is tragic what Kenyans are going through. When doctors go on strike, we don't go on strike for fun. That's why the last strike we did was 7 years ago. Before that, another 7 years ago. We know that when we strike, people hurt, people suffer, people even lose their lives. And that's why we take our time. We look for other ways, alternative dispute resolutions. We go to court to sue. We go for mediations for 1 year plus, despite the law saying mediation should last only for 90 days. Because it's not something that we do for fun. Yet at this point, what are the options left? The government and the employer must know that it is them who swear and take an oath to protect Kenyans. The Kenyans are the patients and the doctors. They are to facilitate us to go to work. So when they don't facilitate us, what do you want me to do? When they don't pay us on time, what do you want us to do? When they don't post interns who are supposed to help in correcting the shortages, what do you want us to do? When they don't pay fees to train the physicians that need to go to those hospitals to see Kenyans, what do you want us to do? It is the government, I repeat again, who is on strike. As we keep on saying that, if the government did their work,
We wouldn't be here.
honored the agreement and the CBAs and all that, we will not be here. So I really empathize and sympathize with Kenyans. As a union, we even begged them that we should have a minimum service agreement. They refused. We went to court and the court ordered them to sit down and have an agreement with us on minimum services. They refused. Because as a union, we believe in ethical strikes. We don't believe that Kenyans must suffer or die for our strike to be successful. But yet we have to agree that our employer that what are the minimum services you can offer when you're on strike? But then again, we also agree that what are the normal services that must be offered when there's no strike? And that is why government will never have that discussion. Because they know that we must have a normal services charter, then from there we can draw minimum services. For example, a level 4 having 50 medical officers, that's the staffing norms and standards. Now, if you have 50 MOs in a level 4, then I can say that on strike I'll give you guys 3 or 4 or 5. But since they have not even met the normal services charter, we can't have a minimum services agreement.
You can't have a baseline
Yes,
of what to
yes.
work with.
We're already at below minimum on a normal day. That's why they will not allow that. And that's why the Kenyans must consistently join us. As a union, we take our members on the streets, not because we find it fun walking around, but because we want Kenyans to join us in those marches, on those pickets, to demand for better. Because Article 43 of the Constitution is clear. You have a right to the highest attainable level of healthcare. Ni afya bora. Sio bora, afya.
That's well put. Now, there are 2 concepts and ideas I had in my head, yeah? And one of them is, if the law is changed in a way that the bodies where certain ministries, the individual employees, like let's say different cadres, nurses, doctors, or engineers they are all under different ministries. If these people were given the right to select who will be their minister or who will be responsible for their ministry, do you think service provision would have tilted?
Kenyan society is a little bit messed up. So that until as Kenyans we change our software as a nation, there's nothing. Some of the most difficult people I've had to deal with in these counties and even MOH are doctors. So having a doctor there doesn't mean anything, trust me. Until we develop a culture, a people of kujali wenzetu, kujali maslahi ya mwenzako, to feel your neighbor's pain, nothing is going to change. We have to start from primary school when we teach our children about Utu, humanity. We have to fight things like corruption. Because corruption is what makes this doctor who is straightforward wonder why his classmate who dropped in Form 3 is now a millionaire. And him is a doctor, he has nothing. Then he wants to start chasing. We have to start valuing hard work and discipline in this country. What doctors are asking for that? We did our part. We are the most disciplined, we are the most hardworking kids out there. Why is it now that we have to pay the price of something that we did not ask for? The only thing we were told is work hard and be disciplined, and we did that. Why are we being punished for that? That's what is making the Kenyan doctors so angry, that they did their bit, and those who promised them that have failed to honor that. Right now, what are you going to tell your child if you're a baby? To work hard and be disciplined. To be what? If they see what we are going through. What are you going to tell that Form 4 candidate to work hard? To be what? People think that this doctor is just some strangers we pick from whatever, or from Venus or Mars. These are your children. They are those children you took to good schools and they worked hard and they were the prefects and they went to good schools. They're the kids you carried on TV when they got airplanes and asked them, what do you want to do? I want to be a neurosurgeon. Those are the kids that you sold land to train. Those are the kids you sold cows to take to school. Those are the kids that finally took 7 years in medical school, doing nothing but studying every day of the year, of the week, not going out, not doing nothing, just studying. Those are the kids that today turn up and tell you that 8 months down the line, my future is being stolen from me. Why should I wait for internship for over 1 year? I didn't fail any exam for me to lose 1 year. So these are your children. They are Kenya's children. And the sooner Kenyans discover that by hurting doctors, they're hurting their own, it's up to them to choose what they want to tell their children. The same guys who are frustrating us. Some of them have children who are doctors. I know so many of them who have kids who are doctors, the governors, the leadership. So you wonder that what level of self-hate or what level of, I don't know what to call it. Selfishness would make you that even wish bad for your own child. I wonder.
Now, to finalize, we need to take future steps, right? And this reminds me, about 1 week ago, there was an event we attended, organized by Lead with Yes, and we were speakers on that event. And we had quite a good number of young doctors, students who came in. It was during the same day on the strike. I think it was on a Friday.
Yes,
so we
Friday.
Came, did the picket, and then we left for the event. So it was hard to convince the students that do what you are passionate about. In the sense that if they know that it doesn't look good being a healthcare service provider in Kenya, it hasn't been looking good for some time. What would you say to those students who are in school who would consider quitting halfway, who are tired of this, knowing that, yes, this should have been my outlet, but it doesn't look like it's going to happen? What would you say to them?
Let them continue studying medicine. Medicine is still a noble career. Let them not give up their dreams and their hopes because of a few corrupt, selfish men and women. Those men and women will come and go. But Kenya will be here. Those kids will be there, and they will be able to pursue that dream. Let them continue pursuing it. Even if you get to a point that they can't practice it the way they love it here in Kenya, they can still pursue it wherever, man. Wherever you go, you're still treating human beings. You get that? So let them pursue medicine. We will change this trade, and we'll change it for the better. Time will come when Kenyans will ask for better.
That's well put. Thank you so much, Doc. I don't know if you have anything else you'd want to add on. Yeah.
What would you say about the other cadres, like the nurses?
And
Nurses are
clinical
also
officers.
in a poor position as well compared to the doctors.
I really feel for the other cadres because they're equally victims of this selfish game being played by politicians. And I feel sorry for them because their unions don't seem to realize quite early enough that whether we are hung separately or hung together, these guys are still going to hang us. And we have to push back. So I'd wish to tell them that let them build their unions bigger, better, stronger. If there are individuals there who are compromising that dream, let them kick them out. They have no other tomorrow. Your tomorrow is today. Nobody's assured of tomorrow. You can die today still hoping for a better tomorrow. And you have to demand that your career gives you the best of today that can then assure you of a better tomorrow.
That's all, but
Yep.
Yeah.
So I have two final messages. First is to Kenyans that the only thing that is assured in this life are two: breathing and the day you stop breathing. Death is assured. If you are lucky, you'll die in your sleep peacefully. But for the most of us, you'll either die sick or in an accident. Question is this: on your deathbed, will you be, what kind of death would you desire? Will it be a comfortable death with the doctors and loved ones around you, or a miserable death with so much pain and drugs missing? That one is only answered when you take charge of your health. Let us stop letting everything to politicians. When the roads are bad, I see Kenyans carrying twigs and complaining. When school failed, they carry twigs and chase the teachers. But every time a mother dies giving birth, every time a child dies because there's no drug, every time somebody dies because there's no doctor, we say that is God's will. But God cannot will for 5-year-old children to die in Kenya and Japanese to live up to 90 years. No, not the God that I serve. The roads are perfect, they're good. But if you don't fix healthcare, the roads will be used to carry your dead. You get that? If you don't fix healthcare, the children you educate up to professor level will die with that knowledge because there's no healthcare. Let us fight for healthcare. To the doctors, you have done so well so far. You have shown the world in what you believe in. You have shown the world that you're done bending to be ridden on. You have shown the world that no matter how flat we lie, they don't necessarily complain that we're not flat enough. So we rise. So we stand up and push back the bully. For this strike, we reclaim our dignity under our union that we love so much, under our union that will protect us from the stormy days present today and tomorrow. Thank you.
Thank you so much, Doc. It was wonderful to have you here. I think we'll call it now.
Yeah. It's a nice show.
Just to ask you, Doc, yeah? This one is going to still be on camera, yeah?
Uh-huh.
On about Linda Mama and the insurance service.
Oh, so.
We'll listen to you soon.
It's
Just
okay.
about Linda.
About the concept of Linda Mama, what's your take?
Yeah, so if there's one thing that the former president did so well, President Uhuru, was to really empower NHIF and introduce the Edu Afia for schools, Linda Mama for women. Because for the longest time, women used to give birth at home because they feared the cost of paying for the hospital bill. And for Linda Mama alone, the hospital deliveries moved from 49% to 82%. And so, women, all they knew was to turn up in the hospital and deliver. So it breaks my heart when the Social Health Act comes in place and scraps Linda Mama and brings a lot of confusion in this old Social Health Act. And it's going to have an effect on the women. Already I'm getting phone calls, people are worried, can my wife come deliver in your hospital, Kenyatta, blah, 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 can I afford it? So it's a very, very sad thing that we have rolled back the gains. And we hope that along the way they'll reconsider scrapping that Linda Mama. But generally, even just the Social Health Act, generally, it has its benefits, it has its weaknesses. But if you really want to finance healthcare in this country, we must go for the tax-based funding, where you can put 2% of VAT to healthcare. Everybody will pay. Our country, 80% are not on any salary. So you're going to burden 20% of people deducting their salaries to make them pay for the 80%. It can't work. The concept of contributory form of insurance works in countries like Germany, where 80% are employed. Or in Japan, where 96% are employed. But in a country, it won't work. Even if you put a penalty, then do the motorcycle guy will only pay when he has a broken leg. Then he'll pay. And even if you make him to pay for 2 years, that's only 12,000. 500 times 24 months, that's 12,000. Yet the cost of fixing that leg will cost 100,000. So there's something called adverse selection in insurance, where somebody, like you have a car, and when you get the accident is when you pay the insurance. Okay, that's Sarah. So the same thing, that insisting on that contributory form will not work, because people will only pay when they are sick. let them go for the tax base, where countries like Ghana have done that. You're tied to a tax so that 2% of VAT goes to tax. That's done with
To
it.
health.
Everybody pays VAT. Somebody will give that 2% to healthcare. Thank you.
So, finally, to the members of the audience, you can chip in your questions. We'll continue with this. And then finally, just like, subscribe, share.
Thank you.
Sawa, Doc. Thanks.